Hey, welcome to our third webinar on from Kiwi Orthotic Services. This morning we are looking at running orthotic design, and we'll dip a little bit into running mechanics as they are relevant to that topic, as well as some shoe design and technologies. And again, more in the view of how they can interact with an orthotic and present as much functionality and reduction for rate of injury. So let me just jump over to my PowerPoint. All right, great. So when we're looking at running orthotic design, the main thing that we're really looking for is we want to reduce injuries. Obviously, we have, this time of year, a lot of season runners getting back to running, getting back to their sport of choice, people that are using it as cross training, and we have a lot of new runners that are out on the roads and on the treadmills, or going into their Orange Theory classes and different things. And we want them to do this as safely as possible. So we're here to make that as enjoyable and as safe a process as we can, as clinicians. So, why would we even look at a running specific orthotic? There's a lot of discussion online and forums and endless rabbit holes you can go down about what kind of shoes you should be using, if there's a perfect solution for everybody. Obviously, as clinicians, you see everybody coming through the door, and there is no one solution. That's pretty clear to most people. There's so much individual variety from person to person that there's not going to be one overarching solution. What we can provide are guidelines. And for running specifically, it's so intrinsically different from walking when it comes to the mechanics of how we move, that we have to take those specific differences into account, right? There is more force over a briefer period of time, so it's more dynamic. The coordination and the muscular response is much more quick. It's happening at a much higher velocity, so that demand is a lot higher. And because of that, it can carry a much higher risk of injury as well. Obviously, you would probably see a lot of runners, whatever clinic you're in, anywhere in the country, and there's going to be a certain percentage of people that eventually get some sort of running-related injury. Right? It's a very common thing, and a lot of that is because it's just it can be a very repetitive motion. A lot of people get into certain habits, whether it's the type of running that they do, the footwear that they're using, or it may be something within their own strong body structure or biomechanics that is putting them at risk. So, key things that I always tell patients are the less variability you have in any given activity, the more likely you're going to create an injury, right? So variety is good. Putting stress on different tissues is good. Throwing in strength training, flexibility. These should all be part of these routines, but we're not going to focus on those things today. So what we do want to focus on is the fact that, we have external devices, whether it's shoes or compression wear or, today's topic, orthotics. We know that these have the ability to affect people, and we want to do this intentionally. We want to do it in view of reducing rate of injury, increasing comfort, and hopefully increasing performance as well, right? The more specific a tool we can present to our patients for the more specific problems, the better they're going to like us and keep coming back to see us for years and years. So, to get into running biomechanics, just a skyline view of this. Obviously, we don't have the time to get really into the nitty-gritty of it. And hopefully most people looking at this come with a little bit of understanding of what's going on, but just very briefly, when we look at running mechanics relevant to pedorthics, we're really mostly concerned with the contact phase of gait, right? So we look at the shock absorption. when you have heel strike, and you're looking at where the foot is landing, we're seeing how the body is naturally attenuating that shock. And of course, pronation within the foot is our natural spring function. It has, of course, spent many years being demonized by a lot of the medical and orthopedic community, and it's taken a lot of years and dedicated research to show it's not the root of all evil. It has a very, very important place, and it can't be limited so much so that we don't get any shock absorption at all. So finding that middle ground of how do we help guide these motions is a big part of where orthotic treatment is today. Right. So obviously the muscles and joints in the foot and leg also share a lot of this load. And when these systems are overloaded or ineffective, other tissues take on greater load, and that's a big part of obviously where we get risk of injury. In the second half of that motion, in that contact phase, that's when we're switching and transitioning into toe off, the body shifting to create propulsive forces, mostly through the sagittal plane, right? We want to resupinate the foot. We want to have this mechanical function that we understand the joints of the foot have, where when we twist the joints axes in a certain way, we're able to create this rigid or semi-rigid lever that turns the force into that forward sagittal plane motion we call the windlass mechanism. So typically using the first MTP to lever up off the ground. But it requires a coordination. It requires a lot of the muscles and joints working in concert to achieve that efficiently. And that's often where a lot of people struggle, is being able to plantar flex the ankle properly and effectively while engaging the musculature of the arch, whether it's the intrinsic foot muscles, the post-tib tendon, whatever it is that you need to be able to create that leverage. A lot of people have struggles with that, and that's a big part of where we can come in as clinicians. So how can we affect it with the orthotics and shoes? We're looking at things like the total amount of shock, right? The more that we're able to shove padding and cushioning to dampen those forces, well, the less overall shock we're going to take into our body. Because with impact forces, essentially the slower that we are absorbing that shock, the better we're going to be able to, the better we're going to be able to take it. Because that's what force is. It's the more we can reduce the acceleration, the less force the body's going to take, right? We can't just keep on putting cushioning there. So we also have to think about how much volume we're putting underneath the foot, how high that stack height's going to be. So we'll get into running shoe technology in a minute. Other things we can affect, pronation, of course, right? We can, through orthotic or shoe structures, we can decide how much what velocity the foot pronates, at what velocity the foot will pronate, and the degree to which it will pronate, right? So we get to decide through the structures that we put inside the shoe and what shoes we put the patients into, how much of that pronation do we want to see? How much is good or going to be effective for that person? And this is a big part of where individual variability is going to play a role, making that decision. Contact duration and transition of motion. So a big part of running technique is often looking at step rate and how many steps you get over a given minute. And generally the thought is a little bit more is better, because if you are not spending as long in that contact phase on the ground, you're not putting as much progressive load on certain joints and muscles. You're getting smaller loads in more cycles, essentially. Right. So if we can help to reduce that contact duration, smooth out the transition phases of movement, that often will help as well. Pressure distribution within the shoe, is a no-brainer. If we can make sure that we're not getting pressure hot spots, we're evenly distributing those forces, the more comfort we feel, typically the less foot pain, less chance of blistering, And same thing with shoe fit. Uh, we ideally want the foot, whatever insole you're using, and the shoe itself to all move as one unit. Whenever you have wasted motion inside the shoe, loose fitting areas, that's where you're going to start to get extra energy wasted, sometimes to harmful effect, by clenching of the toes or shifting back and forth, getting black toenails. So shoe fit is pretty paramount. And if you have someone with a hard to fit foot, well, for one, they should be seeing a proper footwear fitter to be able to get as close as possible to their proper fit. But if they've got a really, a foot that's off the standard deviation, whether it's short and wide or long and narrow or higher through the arch, and you have to accommodate some form of that. Well, an orthotic can help to secure the foot in the shoe to some degree, right? There are things that we can do, strategies we can have to apply and relieve different pressures to get that fit proper, or as good as it can be, essentially. So to get into running shoe technology a little bit, to dive into that basket of snakes, running shoes have gone through a huge evolution. We don't want to get too granular into this. Suffice it to say that it's been a very turbulent evolution in terms of what things get popular, where the market trends tend to go, and certain assumptions have tended to drive a lot of those features in shoes over the years. So we've seen, shoes that back in the past were just leather cross trainers with a flat sole and didn't really have much in terms of functionality, but then maybe they started to incorporate holes and ventilation through the upper for reducing moisture and blistering. And we see bigger midsole cushioning being put on. We see heel wedging and more pitch being applied to shoes, right? So we have all these different aspects to shoes that have been slowly incorporated over the years to try to improve different functional aspects of movement. So, just to kind of quickly go through things, obviously ventilation is a big part. Cushioning, just to reduce shock. Pitch, for everybody hopefully knows what pitch is, but we're talking about the drop from heel to the ball, which allows more mechanical advantage for the plantar flexor group, for the ankle especially. And it also helps to increase a bit of cushion on heel strike. That's a pretty contentious point for a lot of runners, depending on what surfaces you're running on, your own biomechanics, how tight the calf muscles are. And then to look at the next point, rockers. For rockers, we're looking at then the rise from the ball to the toe. And the stiffer that is, the more rise or toe spring that it has, the more easeful that transition forward is going to be. Or as I like to tell patients, the more work the shoe is doing, right? Versus the mechanics within your foot and your ankle. So the less stress it's putting on those systems. And of course, pronation control. So, different companies have experimented with lots and lots of different ways to try to control pronation, whether it's through stiff heel counters, multi-density foams, guide rails, stiffer shank strategies, etc. And all of this to try to control any motion essentially that is not within the sagittal plane. So anything that's not forward momentum, we're trying to stop that. We're trying to limit it and constrict it because it's wasted energy and it's not essentially. A big part of that we've seen in research over the last 20, 30 years is saying, well, is that really the case? Because people that do fully restrict those motions actually tend to see more injuries in those cases, right? Through some of the studies that have been done. So to dive into that a little bit more, we have a very complex history here, but there's been some assumptions that pronation can lead to a higher risk of injury. So then companies said, okay, let's make shoes that reduce that. And then studies began to come out saying, well, why? Why are we reducing this pronation? Does it actually reduce risk of injury? And what the studies really came out with is saying maybe not. It was inconclusive, but there wasn't overwhelming evidence at all for that reduction of injury in a more stable shoe. And then, of course, we had the big market shift towards minimalism and barefoot running, and there was a big shift in that public opinion and conscious thought of how we approach that. So we saw less and less of those more structured shoes. And then we, of course, had a shift in saying, okay, well, is barefoot running good for us, right? Is minimalism good for us? Are we trying to go to more natural states? And when we're looking at the overall population, we saw, well, through a couple of studies again, um, especially from some of the work that Dr. Michael Ryan has done over the past 20, 25 years, the evidence was showing that that's not the ideal answer either, right? We saw a big rise in injuries with a lot of people that got into minimalism or barefoot running. And not for everybody, it worked wonders for some people, but that again goes to show there's just a lot of individual variability. But for the greater population, it's not going to be one or the other, right? We have to find a middle ground. So market trend again kind of reversed, and now we're in more of this maximalism zone where we're starting to see these high stack height, very highly cushioned shoes with wide base of support, saying let's go all shock absorption and see where that takes us. Which to do sort of a little bit of a closer look on one particular study that Dr. Michael Ryan did a few years ago. Nike said, well, let's actually ask these questions, and so they partnered with Dr. Ryan and the UBC Sports Medicine Research Foundation, and they said, okay, well, let's just put two shoes up against each other, one that's got a very high stack height of a very soft foam, something that's neutral but geared towards that shock absorption, and let's put it against a traditionally structured, more stability shoe. And what they found was essentially there was a huge reduction of rate of injury by about 52% in the shoe that was geared towards shock absorption. So this is, it has huge implications not only for what shoes people should be more considering when they're buying footwear, but it also, I think, has a lot of implication for how we design orthotic support. So a lot of this is just to say, we should be designing these with intent, right? As much as we try to give tools for templates and common things in our design software, we want you to think about how you're affecting people's feet during these very specific movements. So it starts with assessment, as most times, stuff like this does. You're looking at, okay, well, if you're getting an issue, is there anything abnormal about your biomechanics? Or if you're getting into activity, maybe there's nothing going wrong yet. Let's do an assessment. Let's see what's happening biomechanically, physically, structurally. That might be a red flag. So you're looking at, what might be just individual variation versus what's actually, a risk factor, what might actually contribute to injury, right? So obviously red flags, pain, coordination issues, stiff or hypermobile joint structure, these are things that are going to sometimes hamper or hinder somebody getting into running or progressing in their running, because they will limit essentially what you can do or how quickly you can grow. And when you're trying to get competent in a certain movement, how quickly you progress is a huge part of if you're going to continue to do it. Because if you don't see your progression, there's a lot of motivation that comes along with that, or lack of motivation that will come with that if you don't see improvement, right? So like everything we do, we're trying to limit or reduce those limitations. So, you know, we want to talk about excessive pronation, and I didn't put it on the slide here, but excessive supination as well, or underpronation. You know, what is excessive? Is excessive going to mean the same thing when somebody's walking versus when somebody's running? If you're spending less time in that contact phase, is it as important that we really control hindfoot motion when it's such a small portion of your running cycle, of your running gait cycle, right? So you want to think about those sort of questions. And what I like to put forward to people is saying, well, I don't mind so much about the very specific angles of the joints. What I'm more concerned about is if it delays things. If you have so much movement or lack of movement that it is actually affecting the amount of time that you're spending transitioning from heel strike to full weight bearing to toe off, that's a problem, right? Anytime you're getting those long durations from weight acceptance to propulsion, that can be time where your body is trying to coordinate and shift things around, putting stress on places where it doesn't need to be. So those difficulties and delays are big red flags when I do running assessment. There's other things we can talk about here, but I'd like to move on. So, you know, you can look at base and angles of gaits and recovery of leg, all those sort of things. Calf musculature tension obviously plays a big role as well for a lot of people. But let's move on. So, you know, again, we won't go too far into any individual problem, just because we don't have the time today. But you know, things we see often with a lot of runners: shin splints, metatarsalgia, Achilles tendinopathy, knee pain, and plantar foot pain, plantar fascia pain specifically. You know, when you look at all these things individually, you're like, oh yeah, I see patients with these all the time. A lot of them come down to overuse of those certain tissues because they're taking too much load or too much tension as you're going through that cycle. And depending on what your own biomechanics are, you may see one of these more than the other because that's just the tissue that's taking the load. So a lot of your assessment will come down to saying, okay, well, you've got tight calves. So when you're running, it's really difficult for you to actually recover the dorsiflexion of the ankle. And so you're having to overutilize a lot of your extensor musculature, and they're fatiguing really, really early. Or because the calf is so tight, it's also fatiguing really early, and the insertion on the or the origin of those muscles on the tibia is creating a lot of stress, that medial tibial stress that comes with shin splints. So how do we address that? Well, there's a lot of other treatments you can look at, but when we're looking at orthotics and shoes, well, shock absorption is a big one. Trying to engage the plantar flexion of the ankle more is a big portion of it. So looking at the pitch of the shoe that they're wearing, how much cushioning it has, looking at their running technique, all these things. So, you know, when we consider the orthotic design, you know, just using that one case, there's a lot of ways that we can interact with the foot here. So just improving shock absorption, improving that toe off, whatever that might mean for the individual. We can look at decelerating or stabilizing excessive joint motion. And I'm talking more about pronation than anything else when I specify that, but it can also mean other things. And then we're looking to prime those natural levers. So in the case of something like shin splints, well, you want to see what is the problem with that sagittal plane movement that might be causing extra stress on whether it's the extensor groups or the plantar flexing group of muscles. So to get into some specifics for orthotic design now, the big shift that we've had in the last couple years in our own clinics and something that we've been trying to sort of push forward is looking at the use of hard shells versus soft shells. So traditionally, a lot of our designs come with that polypropylene plastic, direct mill polypro, and it's still one of our favorite materials for pretty much any use. It has a lot of capability to act as a shock absorber or a controlling device, depending on what depth and thickness and profile that you design to it, right? And a lot of the time, it sort of lives in the middle of those areas. But when we're looking at soft shell materials, specifically the rigid black plastisode that we have on our running template, one of the reasons that we put this forward is it's not as rigid a material. That's obvious, but it doesn't have the same response or rebound that things like plastic and graphite have, right? So when you flex graphite and plastic or polypropylene, it's going to rebound against the foot with a very, very short time frame. Whereas foam materials, they, especially rigid plastisode and things like EVA, they don't rebound nearly as much. Really, it's imperceptible. So when you're impacting the orthotic shell, the question is, should that be responding at all? Because anytime you're spending on the heel or arch of the foot during pronation, you're really just absorbing shock. Some people may need that extra control that a graphite or polypro or any other harder material like that can give. Some people may need that more restricted motion for, say, a more hypermobile or dynamic foot. But for a lot of people, we don't necessarily need that. So if you're looking at a specific orthotic dedicated to running or dedicated to any high impact sport, the soft shells like rigid plastisode, EVA, or the old XPE material that we used to do on our diabetic arthritic designs, these are materials that are really just geared for some pronation control and absorbing and dampening shock. The other nice thing about them is that with rigid plastisode, we can still get a nice firm material with a fairly low volume. So we can grind it quite thin, so it sits nicely in a running shoe, whereas a lot of those other materials, even in their bulkier forms, they're going to have more flexibility. So it's one of the reasons we love rigid plastisode for these sport-specific uses. The problem is that if it's going to be an orthotic that's meant to be versatile for everyday use, they're not going to hold up quite as long, right? They're not going to be as versatile to move from different shoe type to different shoe type, and they're going to pack out and break down a lot quicker if they're used for daily use or for work use, unless they're bonded with an arch fill. So looking at, overall orthotic design, what are some of the things we can do? Well, we just talked about rigid plastisode, EVA shells. We can also improve shock absorption by just adding a backing layer. If they've got the volume in the shoe, well, you can add heel pads, you can add heel wells, you can add backing layers of Poron or PPT or Poron XRD to soften the impact in certain areas. Just be mindful of the volume that it's going to take up in a shoe. A lot of modern running shoes just don't have that internal volume. They're meant to be a nice, secure fit without putting in anything aftermarket, so to speak. So you have to be cognizant of that and not make the shoe too tight, right? Or doing the orthotic design first and then having the patient take that shopping with them. Take the orthotic to the shoe store and have them try it on with the shoe before they purchase it. We can look at reducing the velocity of pronation, right? And again, a lot of orthotics sort of live in the middle ground between reducing the velocity and reducing the degree of pronation. But if we're specifically looking at reducing that velocity, we're typically looking, or at least I'm typically looking at a higher contact with the foot. So catching that foot earlier in its pronation cycle and having it be a more flexible material so that as it starts to impact the ground, the orthotic is going to move with the foot, and it's really there as more of a guide. And this is a really good place that that rigid plastizote can live, because it is also, by virtue of being a softer material, it's not going to rebound against the foot and cause some of those more rigid pressure points that we can get with a high arch polypropylene device. If we're looking on the other end of the equation and just reducing the degree of pronation, we may want a lower and more rigid support. So say we have a foot like mine that is more just hypermobile and just drifts way too much to that medial aspect. I'm looking for an orthotic that doesn't over control the motion, but stops me before I go too far, right? So I need something that's not going to let me decouple my kinetic chain. We'll get into that in a second, but so a lower profile of arch and a slightly more rigid type of material. So for instance, I've tried both polypropylene and rigid plastizote running orthotics. I tend to pack out the rigid plastizote very quickly because I am a very heavy overpronator. I find I need that higher level of control. So for my case, I'm still someone that would use a polypropylene design in my running. But then again, I am a very heavy overpronator. So always looking at that individual variability. Other things we can do within the foot, and looking a little bit more into the propulsion phase here, we can look to improve the mechanics, the efficiency of the foot joints. So we're looking at the timing of the levers, both for the ankle, the first met, the first MTPJ. We want to be able to help those work in a coordinated fashion. If you're doing assessment tests on somebody and you're checking their hallux function, right? If that's limited for one reason or the other, well, simple things like reverse Morton's can help to relieve pressure and tension on that joint to allow more mechanical advantage. If someone's got a Morton's toe, that short first metatarsal bone, doing a Morton's extension can help to prime that joint so it gets better mechanical efficiency on the other end of the spectrum, right? So looking at that and then considering, does this person have too much pressure, too little pressure, in what area, and then how do I accommodate that in the design? Things like kinetic wedges, where we have that cutout underneath the first met, and then that little extra wedge underneath the hallux, it essentially allows the first joint to drop down, but then primes the lever by raising up the hallux and giving you better mechanical efficiency coming forward. Looking at, small heel lifts or just a shoe with a higher pitch if they have a tight calf. That change of the plantarflexion angle of the ankle can really help prime that lever. One term I threw in there, which you may or may not have seen before, depending on whether you took Pedorthics, twisting the plate. If we simplify the foot to essentially just a plate that is twisted so that each end is perpendicular to each other, that's essentially where the foot likes to live as a rigid lever. And what we can do to simplify this quite a bit is increasing the rear foot varus and increasing the forefoot valgus, and that helps to encourage that resupination, that winglass mechanism as you transition forward into toe off. So it's, sorry if I lost anyone there. That was it's a more complex sort of concept if you haven't seen it before. But there obviously is some further reading, or you can always email me with questions. Hopefully it wasn't too obscure. The internal shoe fit is a big part of this as well. So looking at how does the shoe fit? Are you secure? Are you not moving around? And if you are, well, is that something that we can help by filling up certain areas, locking into the heel with maybe adding a pad to the tongue of the shoe, or just increasing the volume of cushioning in the orthotic? Are we looking at bony prominences, callousing, warts? Can we do cutouts to help reduce friction and pressure? So a lot of different things that we can do just by looking at these specific areas of concern. So just kind of winding down the last minute or two. I'm going a bit over time as it is. In terms of design additions, top covers, obviously we've talked about some of these already, and you should hopefully be aware of all that we can do in orthotic design. Think about those posting angles when you're designing the orthotic. What is different about their walking mechanics versus running mechanics, and do we want to try to encourage something different? The cast fill. So when we're looking at how much contour, how tight do you want the orthotic to fit to the foot, minimum is a tighter fit. It's going to give you a higher contact, whereas maximum is going to be a slightly lower, less aggressive option for that arch contour. Metatarsal pads, of course, just give a general shaping to the transverse arch and offloading for the forefoot. Reverse Mortons and Mortons extensions, arch fills. We won't go through all these. There's lots of individual things that you can do. And then top covers, of course. What's your priority? Are you looking for grip? Are you looking for cushioning, breathability, durability? All those things come into factor. And lastly, we're just going to look at, the templates. You should see these in the newer catalog that's been put out, but the running template is going to be defaulted to that rigid plastisode. So look for that. And then, of course, the general sport, I use this with a lot of people for running as well. And even just the walking design will work very well as a running orthotic for many, many people. Right? But that, sorry for rushing through the last little bit. I'm trying to keep it under 40 minutes or so. That is the webinar today. Hopefully it was of some value to you. If you weren't able to make it during the time today, hopefully you're able to find a bit of time later to peruse this. Okay. Anybody that's still around, obviously, if you have some questions, let me know. I think it's just a few of you, but otherwise, have a good rest of your morning. Olivia, what's the longevity of the rigid plastisode versus the EVA? That's going to depend on a few factors, just like EVA longevity will depend on whether or not there's an arch fill, essentially how much is that material allowed to deform upon compression. So if you say you just have a single layer of EVA foam as the shell, if it's a EVA 55 durometer, say somebody with like 150 to 200 pounds body weight, they're probably going to break that down in 6 months, and it would be a little bit longer with rigid plastisode because it does carry some more rigidity. In terms of how it fits into the shoe, the idea behind the rigid plastisode being fitted into that running shoe is that it has a nice contact. So if it's a proper fitting shoe, the shoe almost acts as that arch fill. So longer than EVA would be the simple answer, but there's a lot of factors that it might depend. If it's in a very high volume shoe and the rigid plastisode is allowed to deform a lot, it's not going to last very long, but neither would EVA then. So sometimes an arch fill may be called for to increase the bulk of that, to reduce the deformation. Did that answer your question? Awesome. All right. Any other questions before we sign off? All right. Cool. Have a good morning, all.